What's going on, guys? Welcome back to W.D.Y.D. CSP. What do you do as a central store processor, guys? We're going back to basic with Ronguers type instruments. All right, guys, so over in Decon, they did a fantastic job. They did their thing with these Ronguers, and now they're over in the prep and pack side. So what is our task in prep and pack? You know, Decon did their job. We should just be able to pack them away, right? Well, we have to continue the process, right? So we're going to inspect for cleanliness. We're going to inspect for damage, which is very difficult to see in Decon sometimes. And we're going to function test these types of Ronguers, and I'm going to show you what kind of tests they're out there. All right, guys, so I'm going to go ahead and start off with everyone's favorite, the Kerosene Ronguer. Okay, this one's probably this one and the Lexcel Ronguer are probably the two most popular ones. Double action Ronguers are probably the two most popular ones that you'll see. These are biting type Ronguers. So what are we looking for when we're in prep and pack? Okay, we're going to inspect for cleanliness, and we're always going to inspect the working end, right? All right, our lighted magnification, we're going to look for any debris, any bone in that distal tip right there in that working end. Okay, we're going to go ahead and manipulate our instrument, right? And we're going to inspect to make sure that the jaws close completely, that there's no gaps or any rough edges on there. Okay, for the smaller diameter Ronguers, especially like the 1 millimeters, you want to look where that angle is at and look for a crack right in that angle, right? Because that's that can be a lot of stress, even though it's supposed to be for delicate cases. With soft bones, sometimes they bite down on a nice tough bone and wind up cracking that. So look out for those cracks there. All right, all along the instrument you want to inspect. Okay, just about every instrumentation has a screw of some type. That screw should be flush. It should be flush on both sides. There shouldn't be any bioburden in any of the crevices of the actual screw. When you're manipulating your instruments, always make sure that the moving parts you're inspecting for any kind of debris. Okay, so right here in this joint right here, it disappears when it's in the closed open position. But when you close it up, it opens up a nice little gap there. You want to inspect that and see if there's any bioburden or anything like that in that area. Okay, this is a spring action type instrument, so that spring is actually connected. Okay, you want to make sure that that spring is together. So right there is taken apart. You want to go ahead and put it together, give it that spring action, but look at the screws that are on there. All right, the screws should be flush. There shouldn't be any stress cracks emanating from those screws. So you definitely want to get your lighted magnification in there to make sure that that's good. Okay, feel your instrument. Okay, if your instrument is sliding back and forth flawlessly, then you're good. But if you feel like it's sticking at any point in there, you may have to lubricate. There may be some bioburden trapped in there. You may want to send that back to Decon and the set to get it re-cleaned again, because there might be something in there. If this isn't a take apart, which is not, there might be something in there that's hindering the instrumentation, or it may be that it needs to be lubricated. Please check with your IFUs. Don't just go ahead and lubricate anything, because what kind of lubrication are you going to use? What does the IFU say? Should it be an oil base? Should it be a water base like our instrument milk? What type of lubrication? Should only be lubricating instruments based on what the IFU says, right? You might have to wipe off the excess, allow it to air dry for a few seconds. Make sure you follow those IFUs, okay? Now, comes to the function testing of your Ronguers. So you want to make sure that it does what it's supposed to do. This is using a trusty index card. As you can see, I already tried it. This is my personal index. This is my personal business card. So please, I'm not defaming anybody's business card. I'm not disrespecting. This is my own. All right. This is to my little mobile bartending business. But anyway, what you want to do with your Ronguer is you want to go ahead and give it a nice little bite here. It should be a nice, smooth, clean bite, right? Shouldn't be that you have to pull it apart or anything. Shouldn't be that it's leaving, that you're like twisting to get a piece off. Should be nice, clean bites coming off of that card, right? But please, guys, when you're doing that, make sure that you retrieve the testing material. Okay, place that off to the side or in a trash can near you, and then inspect that biting end again to see if there's any lint or any frayed pieces of the testing material left behind there. Okay, that is that type of rondure there. Okay, another famous one is the double action here. A lot of hinge areas here, guys, to inspect for any debris. Okay, a lot of screws. Make sure those screws aren't backing out like these are. As you can see, some of them are backing out right there. Okay, these are nice and flush and protruding actually. These two right here are actually backing out, so this instrument needs to go out for repair. But in order to test this instrument, okay, we're gonna do the same thing. You're gonna take about a third of the jaw there. You're not gonna get the whole jaw, about a third of the jaw, and you wanna hear what sounds like a hole puncher, right? Or that you're cutting your fingernails. Okay, again, I say when you do this, guys, please make sure that you're retrieving your testing material and that you're re-inspecting that distal tip there, because a lot of times when you do that bite, and I don't know if you're gonna see this on camera, is you leave like little frayed pieces on the biting end. It's really tiny little pieces of material from that testing material, okay? So you wanna definitely get that off of there, because if that gets into the patient, that's a foreign body, right? Inspecting always for cleanliness, guys. So manipulate your instruments, look in between, okay? Try not to get your fingers caught in there like that. Some people are a little sensitive, but get your magnifier, look in there really good, make sure it's good to go. All right, for your W.D.Y.D type rondures, okay, these aren't biters, but some of these do come apart, guys. So what you wanna do is you wanna disassemble it, okay? Inspect that traction in there, make sure that it's nice and clean. Okay, again, get your magnifier in there, make sure it's nice and clean, make sure that there's no cracks where it's actually connected to the jaw. Look at both of those ends there to make sure that the pin isn't cracked or bent. Okay, reassemble your instrument. Okay, when you reassemble your instrument and you're already confirmed that it's clean, you want to go ahead and test it. So the test for this is not going to bite through the index card. It's actually going to bite down really good, and it's going to leave a nice little indentation. And let's see if you can see that on the thing. See that? See that nice little indentation on there? It's nice and clean, and it's consistent on both sides. All right, that is your test that you do for your W.D.Y.D type rondures. Then you have other rondures that have flush ports, okay? This is again like a W.D.Y.D type, but it actually has a flush. Okay, for this flush port, you want to inspect for cleanliness, right? So how do you inspect that? Well, you have several methods, guys. You can use the sterile water flush. Draw up some sterile water, put it onto the port, away from your workstation, preferably off to the side onto a white liner. Is a little bit of solution goes through. See if you see anything coming out of the other end, right? Okay, if you don't see anything, discard your water, draw up some air, and then flush this until it's dry, right? If you don't like that method, you can use the air purge, one that I'm not very fond of, but you can get some instrument air, again, away from your station, over a white liner. Hit a pulse of air in there to see if anything gets discharged on the other side. And that's another way of inspecting for cleanliness. A third type, which is one that's becoming more and more popular, are borescopes. But again, you have to make sure that you have the correct size borescope to go down that lumen. Do not force it. If you don't have a borescope that can go down there, that option's not available to you. You can use soil testing. Some of them allow for flushes of sterile water to capture it and test. Others have little brush styles that you can go down there and check for any debris and put it into a little vial and it'll change color. And lastly is one that many people are not very fond of, and that's the brush method. If you have a brush that's small enough, you want to go ahead and go down there, come back out to see if it comes out the other end, great. If it doesn't, pull back out slowly, see if there's any debris in there. If there's any debris, send everything back to decon to get reprocessed. If it's not, you're good to go. All right, guys, that's all I have for you. As always, stay true to yourselves, keep it 100, continue educating yourself, and until next time, peace.